The World Health Organization's top official, Maria van Kerkhove, cleared up the misunderstandings that arose after an observation she made about COVID-19 patients, which began to confuse people. The clarification comes at the time when the virus still continues to peak in many countries across the world. Maria van Kerkhove, the technical lead on World Health Organization's team, clarified doubts and answered questions surrounding the novel coronavirus. Earlier, Kerkhove had suggested that only infected people who show symptoms could easily transmit the virus. Kerkhove had also claimed that people misunderstood her statement, which said that the transmission of coronavirus by infected people with no symptoms was quite rare. However, the technical lead of the WHO was referring to a few studies in the field and not the entire picture.
It still appears to be rare that an asymptomatic individual actually transmits onward. What we really want to be focused on is following the symptomatic cases. If we followed all of the symptomatic cases, because we know that this is a respiratory pathogen, it passes from an individual through infectious droplets.
The comments made by Maria van Kerkhove triggered confusion and questions among the scientific community. People started questioning if healthy people too had to wear protective masks to fight COVID-19. However, the WHO issued a clarification later which said that patients with no symptoms could also transmit the virus.
There are some estimates that suggest that anywhere between 6% of the population and 41% of the population may be infected but not have symptoms, with a point estimate of around 16%. I don't want to get too technical, but that we do know that some people who are asymptomatic or some people who don't have symptoms can transmit the virus on.
The WHO's media chat box also showed questions and answer column trying to clear misgivings on COVID-19 transmission. After terming asymptomatic transmission as rare, Maria van Kerkhove backtracked on her statement and announced that it was not scientifically possible to ascertain that asymptomatic patients are not rapid carriers of the virus. There is a huge scientific uncertainty surrounding the transmission of COVID-19. Nevertheless, research finds that asymptomatic infection could be attributed to around 30 to 50% of the cases. As of now, the deadly virus has infected more than 7.3 million people across the world and has killed over 413,000.